You're listening to Health Professional Radio. My name is Wayne Buckler, and today I'm joined by Lisa Rath. Lisa is an epilepsy support worker with the Epilepsy Foundation of Victoria. Lisa, welcome to Health Professional Radio.
Thank you, Wayne. We've actually just as a matter of interest had a name change. We used to be called the Epilepsy Foundation of Victoria, but we're now actually called the Epilepsy Foundation, probably to reflect that we're not just providing services in Victoria, which might be something we might discuss a bit further into the interview.
Yes, let's talk about both services and where you provide them. What does the Epilepsy Foundation do?
Well, we're a community-based, not-for-profit organisation that was originally established by some enthusiastic parents when there was no support about 50 years ago for people living with epilepsy in the Victorian community, particularly in Melbourne, during that phase of sort of early deinstitutionalisation, if you like. So we've been around for 50 years and predominantly provided services in Victoria, although gradually over time we've certainly provided some services interstate as well, and that's likely to expand. But we provide a range of services, so we fill the gap, I suppose, post-hospital. Epilepsy is a really complex family of neurological conditions, so one of the important things to do, aside from providing emotional support to people when they're diagnosed with epilepsy or to parents when children are diagnosed, is to actually provide accurate information about the specific type of epilepsy that particular person has been diagnosed with and what it might mean for that person. So the provision of information is vital, and one of my tasks during the week is to work on a helpline, and we do get calls from throughout Australia because it's a universal 1300 number, and we get a range of people contacting our service with all sorts of questions about epilepsy, and it might be partners, it might be parents, it might be GPs ringing, wanting to know a bit more about driving regulations, for example. So they're people who really are needing some immediate assistance and want some specific information. We've got a fantastic library. We've probably got the best specialist epilepsy library in the Southern Hemisphere. We subscribe to lots of international medical journals that focus on neurological issues and specifically epilepsy, lots of medical textbooks, also lots of fantastic books and resources, DVDs for the general public as well, the interested general public and people who are diagnosed. We do a lot of education. We've got nurses on staff. So for some people diagnosed with epilepsy, if they have a tendency to have prolonged seizures or clusters of seizures, their treating doctor may prescribe an emergency medication called, and usually it's midazolam these days. So we have nurses who can provide training in the community in a range of settings. They often go to preschools, childcare centres, schools, secondary colleges. They'll provide training to staff in those settings, in the disability setting. In the education context, lots of staff are trained to administer midazolam if a student has a prolonged seizure at school. So that's a very important part of our service. We can provide training in the workplace. So if someone has epilepsy and it's having an impact on their capacity to work and they want some support from our service, we have the capacity to go out and provide some training for their colleagues and their managers. And it's a whole range of other things. We have some peer support programs, we run getaways, we provide an advocacy service that's very much tailored to the individual person's set of circumstances.
And I can believe that if you've been recently diagnosed or have a child recently diagnosed, the kind of advice that you've been given is a bit like a medical monster. You know, there's heads and hydra and legs everywhere. Having someone you could then quietly have a discussion with who could explain it to you would be just invaluable.
Absolutely. I think there's no doubt about that I think when any of us think about any sort of significant medical diagnosis that we might be given over our life's journey, at that point, that very first point of diagnosis, the doctor often gives quite a lot of information and we're not really always in a position to absorb all of it. So having that backup and for people to feel safe to discuss issues that are quite personal and quite emotional at times and to feel safe to do that is vitally important. And to be able to ring and get pretty much instant support is also something people really, really appreciate.
Lisa, most of our audience are clinicians of one sort or another. We get a lot in acute care and a lot in aged care. What's the message you'd like clinicians to hear from you today as a result of your chat with us?
Well, I think a couple of things that come to mind. I think there's a lot of work we could do to achieve a much smoother transition from the hospital setting to the community setting. And we probably need to do a much better job at educating clinicians within a hospital environment that our service exists and that we can provide invaluable support for people. So that's a big challenge, and we've established excellent working relationships with the paediatric neurology unit at the Royal Children's Hospital, for example, very close working relationship there. But we need to replicate that much further. I think, interestingly, in the aged care area, the highest onset of new epilepsy occurs in very young children and the elderly. Oh. And we're very aware that people are living to a much older age these days and generally living very well, but there's quite a very high incidence of new onset epilepsy in older people over the age of 65. And that's often not recognised. It's often underdiagnosed, and all sorts of other potential explanations are given when people start having funny episodes or faints or whatever. And epilepsy is often the last thing that's considered in this context. But it's a bit of a hidden situation in older people, and we really need to do a much better job at educating the wider hospital community about that. And I think, the other challenges are when people present to accident and emergency departments and the staff that see them, maybe because they've had a prolonged seizure, for example, they're often put on medication, anti-epileptic medication, that a neurologist would not necessarily prescribe in the first instance. If someone was actually referred to a neurologist who specialises in epilepsy, and they're called epileptologists. So actually getting that accurate diagnosis at the outset, a really good treatment plan, a clear understanding of what role the person with epilepsy has to play in managing their condition is really critical. And epilepsy is often overdiagnosed too and confused with, people fainting, for example, or cardiac syncope is a much more common problem. And people, when they faint, often have some body jerks, and you see that with players, footballers that are knocked out on the field. You can see there's a bit of convulsion sometimes at the end. So people in less than expert hands are often mistakenly identified as having epilepsy when they may not. They might have a syncopal cardiac syncope problem or the reverse. So it's getting an accurate diagnosis is really critical.
You're listening to Health Professional Radio, and I'm in conversation with Lisa Rath, who is an epilepsy support worker with Epilepsy Foundation. Lisa, what's the biggest misconception in your work that, drives you nuts and keeps you awake at night?
Oh, there's a few, Wayne. There are a few. I think the things that come to mind is that no matter how hard we try to educate the general community, there's still an enormous amount of ignorance in the community about what epilepsy is and what seizures look like. Most people think seizures are the convulsive seizures that people commonly still refer to as grand mal seizures, but they're actually more accurately referred to as tonic-clonic seizures. They're not the most common seizure, yet people tend to associate everyone with epilepsy or assume that everyone with epilepsy has that type of seizure. The more common type of seizure is a thing called a focal seizure, where the seizures sometimes are experienced subjectively and there's no external clues that the person's having a seizure, or the person may behave in a funny, strange, unusual way that's often attributed to other things like alcohol-induced behaviour or a mental health issue. So there's huge ignorance and challenges in the community and even in amongst clinicians, unfortunately. The other challenge is really the stigma. I mean, we've seen amazing changes in the mental health area. People are so much more willing to speak out about depression, anxiety, other mental health conditions. There still remains this terrible stigma surrounding epilepsy, and people are often afraid to disclose that they have epilepsy because they're afraid of the consequences that might flow from that. So there's some of the massive challenges really facing the community. I mean, the reality is 70% of people who get diagnosed with epilepsy ultimately get complete control of their seizures on the anti-epileptic drugs available to treat epilepsy. So that's a significant percentage of people who will be able to drive, for whom the epilepsy has a relatively minor impact on their life.
Lisa, let's hope that we can dispel some of those misconceptions today with our audience. Is there a website where people can get more information?
There are a range of really good websites. Our website's currently undergoing redevelopment, and I wouldn't say it is the most outstanding source of information, although we do get a lot of people going to our website, so I certainly will give you that address, which is www.epinet, that's epinet.org.au. But there are some outstanding international websites. There's an American one called epilepsy.com. It's an excellent source of very reliable information. There are various UK-based websites as well. There's Epilepsy Scotland. Epilepsy Ireland has also very, very good information. Epilepsy Action UK is another very reliable source. And of course, closer to home, the Royal Children's Hospital Neurology Unit is an excellent source of information about childhood epilepsy.
And if people want to get hold of you, Lisa, having heard you today, can they ring your organisation?
They can. They could ring the 1300 number, which is 1300 852 853. And as I say, we field calls from people throughout Australia, predominantly from Victoria and New South Wales, but throughout Australia, and we're always happy to speak to people. Now, we're not an emergency 24-hour line, so we are open. The lines are open from 9 to 5, Monday to Friday.
Lisa, thank you very much for your time today. I do appreciate you making yourself available, and it's been very informative being able to chat with you. Your passion and caring just comes flooding across the phones in your voice. So thank you very much for your time.
Oh, thanks, Wayne. Well, thanks very much for the invitation. Much appreciated.
And we do wish Epilepsy Foundation well. You're listening to Health Professional Radio. My name is Wayne Buckler. If you've missed my interview with Lisa, there's a transcript on our website. There's also a sound archive on both YouTube and SoundCloud. Our website's www.hpr.fm. This is Health Professional Radio.